Hi, everyone. Welcome back to IK for Smiles. In honor of Mental Health Awareness Month, I have one of my favorite people here with me today, Dr. Suzy Ismail, who is the founder of Cornerstone, author, educator, humanitarian, and advocate for faith, family, and wellness, amongst so many other things. Welcome, Dr. Suzy Ismail. So nice to have you here today.
Thank you so much. Assalamu alaikum, and thank you for having me on this program to talk about the important topic of mental health.
We reached out to the community, and these are some of the most common questions that we received. So we'll get right into it. The first question that the community wants answered is that mental health and dentistry often intersect in unexpected ways, dental anxiety being a major one. So, how can doctors and their teams create a more emotionally safe environment for their patients?
Yeah. So I think that's a great question. And I think, many of us have probably experienced that hesitation. I know I myself do as well, that fear of going to the dentist, the idea of like a root canal can, really like cause the anxiety to rise. And I think there's a lot of maybe misperceptions around dental practices, around, certain procedures that are done. And that kind of increases the fears that people may have related to seeking dental health care. I think, part of debunking anxious thoughts is being able to provide, rationale that speaks down those thoughts, that essentially brings you from the brink of thinking the worst about something to being able to think the best of that thing. And dental healthcare is no different. Being able to, instead of fearing the possibility of a root canal and deterring or delaying, seeking out your cleaning or your annual checkup because of that fear, instead, working yourself towards a place where you can recognize that the pain that you're imagining may not be quite as bad as what you're thinking of, and being able to do some research on it. So looking at the success rates of, getting a root canal, looking at preventative measures, and I keep mentioning the root canal because that's the one I tend to hear most often, related to fears. But even, the idea of like, oh, what if I have a cavity and it's going to be uncomfortable? What if there's gum disease? What if there's a lot of negative what ifs that can be associated with seeking out that healthcare, that dental healthcare? So being able to talk down those negative what ifs and instead, guiding your mind to a place where you say, you know what? Let me go in, let me talk to the dentist, let me see what's going on, and not entering with fear, but entering, equipped with intelligence and knowledge of what's to come.
Well, thank you very much. That's really helpful, and it's very helpful for myself and my team as well to make sure that this is how we're going to be taking care of our patients.